Hi, I'm Dr. Santosh Raj, General and Laparoscopic Surgeon, Motherhood Hospital, Banashankari branch. Today, I wanted to talk about hernia in women. Hernia is a defect actually in an anterior abdominal wall. The defect, it presents as a bulge. The bulge is predominantly seen when they exert, when the abdominal pressure is increased, while coughing, while lifting weights, or when there is any kind of abdominal pressure increase. So there are different types of hernia. In that, the most common in women, what you can see is umbilical hernia around the umbilicus. In the umbilicus or around the umbilicus, there will be usually a small bulge. This is how the hernia present in umbilicus. If the patients have undergone previous surgery and there is a hernia in that scar line, we call it incisional hernia. So there are other kinds of hernia also, like femoral hernia, epigastric hernia. Everything is presents as a bulge initially. It will have a content. The content will be usually the abdominal contents which protrude out of this defect will usually be the content. Usually it can be a fat, it can be your intestines. So the major problem what you will have is the complications of the hernia. Initially you will have just a bulge. Some patients might have just a pain in the bulge. The complications will show like the bulge usually which appears on straining and disappear on lying down. Eventually sometimes what happens, the bulge might not disappear. It will stay there. Even on lying down, it will not go inside. And then patient might develop vomiting because of if there is intestines in the as a content, and patient might develop constipation or complete blockage of passage of motions or flatus. So that complications can be developed because of hernia. This is about your hernia and complications. If in case you have a hernia, usually a bulge which you will notice by yourself, or it is incidentally found in a general lab scan, ultrasound scan you do. The scan might pick up your hernia defect size or which you would have not noticed otherwise. So in motherhood hospitals, we operate hernias laparoscopically. The advanced form of surgery, we do laparoscopic hernia mesh repair. We have done in over 2 to 3 years, we have done a lot of hernia mesh repairs laparoscopically in motherhood Banashankari. We have done in extremes of age, that is we have operated on an 85-year-old for hernia. The surgery was totally uneventful. The patient went home in 2 days, ambulated in just 1 day, and we have done cases, recurrent cases. The patients were operated outside 3-4 times for hernia, and they had come for consultation here, and we had operated on them, and from then there was no recurrent cases as well. And then we have clubbed hernia surgeries with other gynec surgeries here, like hysterectomy with hernia mesh repair. We have done myomectomy with hernia mesh repair. But only precaution we'll have to take care is there should not be any infection when we are placing mesh. So in a clean cases, in elective cases, we have clubbed hernia repair with other gynec surgeries, other general surgical surgeries. If it's detected, the patient need not undergo separate anesthesia, separate surgeries for these things. We club these surgeries and do it in a same sitting so that patient get rid of it at the same time and ambulated very early. Laparoscopic surgery, the ambulation is very early, that if in case we operate today morning, by evening patient will be ambulated or maximum the next day and discharged after a day or maximum within 48 hours. So in case any of you have hernia complications, you can come consult us at Motherhood Banashankari. Thank you.